There's a lot of secrecy, a lot of shame, a lot of stigma about talking about sexual behaviors in general. I think that's why the South has a problem with HIV. Here in Metro Atlanta, HIV is at an epidemic proportion.
I was HIV positive. I felt like my life was over.
None of my friends who died from HIV had to die.
For the past few months, I've been documenting the HIV and AIDS crisis in my hometown of Atlanta, Georgia. There are 1.1 million Americans living with HIV, and more than half of all new transmissions are in the South. Black Americans are the most impacted by this crisis. If you're a gay Black man, you have a 1 in 2 chance of contracting HIV, and Black heterosexual women face more risk than women of any other race or ethnicity. In fact, it's so bad, the scale of the HIV crisis in Atlanta mirrors that of African nations like Zimbabwe and South Africa.
Together we will defeat AIDS in America and beyond.
In his State of the Union address, President Trump set an ambitious goal to end the epidemic here by 2030. Experts are optimistic, but in reality, we're years behind the United Nations global targets. Namibia had one of the highest prevalence rates in the world, but is now one of just 6 countries that has achieved the UN goals. Programs here have focused specifically on the needs of women and girls, who make up more than half of the HIV-affected population. We visited a program called DREAMS, which uses education to address risk factors that allow the disease to spread, poverty and gender-based violence in particular. I followed police women, youth community organizers, social workers, nurses, and victims who showed me how a hands-on approach and community-based solutions can create change.
I think the most important thing to learn when it comes to treating illnesses that have a social nature is finding the pockets of people that get left behind. And I think that's what needs to be emulated to see the same success elsewhere.
But back home in Atlanta, I am struggling to understand the slow pace of progress in my own country and community.
Frankly, the circumstances are a little bit different, but the infection and disease itself looks very much the same whether you live in Namibia or you live in San Francisco. What's really important is that every single one of those data points in these large data sets is a person. It's a person in a family, and it's a person in a community.
Wish I could call you up, miss how you put your love on me. You never know when to chill, always talk about keep it real.
I was brought up in a small town called Stuart, Florida. In the South, things are more conservative. I came to Georgia, I was so excited to finally explore and not having to feel like I was limited.
Atlanta has a reputation as a Black gay mecca, but the reality is often different and sometimes dangerous. Young Black people who arrive with few resources and support systems are disproportionately likely to become homeless and contract HIV.
What's she saying? Excuse me, I love you. I would literally sometimes meet up with different people. In that moment, you really don't think about even asking the person, it's like, hey, do you know your status? My tonsils were very enlarged, so got some blood work. Everything came back negative except one particular thing, and that was finding out that I was HIV positive. I felt like my life was over. Who is going to want to date or even love someone that has this type of condition? And then I ended up being completely homeless. One of my case managers, she found a housing opportunity for me. I don't think about it, but I know it's there. Before I go to bed, I make sure I take my medication, and I know I get to wake up still healthy and I'm still alive, I'm still breathing.
Statistics are such a big part of understanding the crisis. I met Chloe Jordan, who is working tirelessly to document an uncounted group in the HIV epidemic, the trans community.
So, good morning, everyone. I was actually raised in Southwest Atlanta, so like Cascade, Nunu, ATL. I used to always just say I'm a girl. That's all I knew. I didn't know about transgender, transsexual, trans this, gender nonconforming, I knew none of these terms. All I knew of anything that was remotely trans was RuPaul, of course, Jerry Springer, and Maury Povich, Is It a Man or a Woman? They really are genuinely... Between 2011 and 2005, I lost 5 friends, back to back to back. I was furious because it was unnecessary. None of my friends who died from HIV had to die. No one had told us this before. I'm approached by a researcher from Emory, and he basically makes me aware that research was about to open its doors to trans women, specifically trans women of color.
It's been a while since we met the last time, so
it was my opportunity as well as my responsibility to try my best to save my own people. If I didn't do it, who was gonna do it? So, I'm old school, y'all all know me. Tomorrow, I begin my work with the Department of Public Health on their CDC cycle, which is also the first trans cycle that the CDC has ever funded. When I first got in this position, I wanted us to have a seat at the table. And some kind of way I finagled the whole table. Our community is highly affected by HIV, but there has not been any concrete data. No one really even knows how many trans people exist. There is no census. So it's that important to take part in this research, to be included in these numbers, to be counted. And I am like amazingly honored to be the one doing the counting. Can you imagine how that feels? This is my song. This is Toni Braxton's Long As I Live. The first verse is about the love of her life. She's still in love with him, even though he has a new girlfriend. I actually began my life as a singer. Like, that's what I thought I was gonna be in life. La 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 la. I like the purple gloves. They kind of make me feel like Dr. Oz a little bit because he always wears the purple gloves.
These are going to be your STIs. This is the multi-test swabs, the urine.
We take approximately 2 hours for a baseline visit with a trans woman, and we retrieve all the data from homelessness, violence, sex lives, and of course there's a full HIV and STI screening done every year. We understand trans women in a way that no cis person or no MSM person or no lesbian person possibly could. We're subject matter experts. Yeah, so who else besides us? Who better?
3 zip codes with the highest rates of HIV in Atlanta all share historical narratives from the Jim Crow era. Generations of marginalization has left its marks on the health of residents. Black leaders have stepped up to help. Larry Scott Walker is working to combat the stigma of being a gay man with HIV.
The story of Black men and Black people in this country is one of resiliency. HIV is a thing that happened to you, but we're not the things that happen to us.
With an ethos of meeting people where they are, Atlanta Harm Reduction Coalition runs programs in the Bluffs, the 5th most dangerous neighborhood in the U.S.
This is a brand new container.
And how long have you been out here?
We just been out here 2 minutes.
Yeah, that thing will be maybe 3/4 full by the end.
Yeah.
People who use drugs are concerned about their health. People bring in used syringes and we give them sterile syringes. That really stops the spread of HIV, hepatitis C, other bloodborne diseases.
Oh, you're so pretty. Look at that. Oh, I do like that.
Black women rarely get the kinds of healthcare they need in the U.S., but it has surprised me to learn just how vulnerable we are to HIV. Sequoia Ayala runs Sister Love out of a big house in West Atlanta, where she's teaching the same kinds of empowerment that I documented in Namibia.
It's really important that any researcher who is interested in ending the epidemic and creating biomedical prevention tools to do so is including cisgender women at all phases. Black women are being screened out and told that they don't need to take PrEP. We don't need to be told what's for us and what's not for us. It should be freely and openly accessible.
Most experts I spoke with agreed that the fight against HIV needs increased funding and major policy changes to expand access to healthcare for vulnerable populations. But here in Atlanta, there's also a lot of hope. All of the dedicated community members I met are making a difference by drawing more attention to what needs to be done.
While the state of HIV in the African American community is a dire one, there's so much resiliency, so much love and power coming out of our communities as well.